I'm live and I've forgotten something which I've just realized, but I pressed the live button. Okay. This is what the pros do. They just carry on as if nothing's happened, and in the background they fix the thing that they've done. So good evening all. It's 7 p.m. I understand there's a big match on. Jackie's in the house. Big up, Jackie. How you doing? Bella Vu. Nice to hear this evening. I have actually forgotten. Now, Instagram, this will have no effect on Instagram, but on Facebook and YouTube, I'm not sure if anyone watches on YouTube, to be honest with you. But anyway, I think people watch on Facebook. Do they? Oh, actually, maybe not. Maybe I won't bother. I was gonna put the questions up. Maybe I won't bother. Shall I not bother? Okay. Actually, I still need to know what the questions are. Anyway, if anyone's got any questions, please feel free to ask. I have got some questions here, which I will go through. Oh, look, I've just booked with you. I'm so excited. Jess, look at that. Yes. Look at that. We've got a booking, guys. We have just got a booking. Ring the bell. I'm excited too, Jess. Can't wait to see you. Right, I can't get the questions on there. That's okay. I'm a pro. So listen, guys, we've got some questions here tonight. If anyone's got any questions, then feel free to ask them. But I normally put questions up on the screen, but I actually forgot to do that tonight, and the reason I forgot to do that is because I've emailed my database about this to see if anyone wants to come and join me. No excuses. I'm not making excuses, just saying. So here we go. So why is it, let's start, because we've got vivid ink tattoos here, I think, so it's relevant. Why is it so difficult to remove tattoos from the hands and fingers? So right. So I'm going to get that off the... Well, the thing that I always say to people about tattoos is there's two things it depends on. One is the size of the tattoo. Two is the location of the tattoo. And so a big tattoo in a good location might be able to be removed, but a small tattoo in a bad location might not be able to remove. So it's the size and the location. And the hands and the fingers are common places for tattoos, but it's a really bad location because there isn't much skin laxity on the hands and the fingers. So good locations are things like the abdomen, I guess. The abdomen's a really good location because there's often a lot of spare skin on the abdomen. And the thigh, yeah, pretty good. Leg, not so good. Arms, shoulders, not so good. Shoulders is risk of hypertrophic and keloid scarring. So certain areas are better than others when there's more skin laxity. And the issue that we often get with tattoos on the hands and the fingers is that patients often say, I've got loads of spare skin, and they pinch their skin and they say, look at all this spare skin I can pinch, and the whole tattoo's, completely gone if I pinch that skin. And then the thing I always say is, look, if you make a fist, that pinch is gone. You can pinch that, but then you make a fist and the skin's tight. So you can't pinch when you've made a fist. So I don't want to take the tattoo off your hand and then you can't make a fist. Or if you do make a fist, the stitches burst open. So the problem is whenever something has to move, there has to be a degree of skin laxity. I've got my finger hand now. So there has to be a degree of skin laxity there. So that is the problem with hands, and fingers even worse. I mean, fingers, again, they have to move. You've got to be careful how you plan your incisions, where you put your incisions. So fingers are worse than hands in terms of the size of the tattoo that can be removed. So actually, even really small tattoos on the fingers cannot really easily be removed. I mean, sometimes we have little ones on the back of the finger, and if it takes all that hair-bearing skin off the finger, that's quite a there's quite a lot of skin to remove, and the fingers are sort of cylinder, so you have to somehow still get skin all the way around the cylinder, and it's very difficult and much more difficult than you think. And I think people often get disappointed about us saying no to them on the hands and fingers, and I'm sorry about that, but that's why, because it's a bad place. Jess has come in. How can I best be prepared for my consultation early Jan? Listen, Jess, what I always say to everybody is that the first one can be a bit like overwhelming and what have you, loads of questions and things like that. So don't worry too much about it. Is the bottom line. Don't worry too much about it. We will obviously go. I don't know what it is, what you're coming for, but it doesn't matter really. Whatever you're coming for, we will go over it. We'll talk about it, the ins and outs of it and things. And I always say to people, you can always come back and go over things again. So don't feel you have to get all your questions in and think, oh my God, I forgot to ask him that. But having said that, by all means, come with a list of questions, write them down. I'm very happy for you to pull out a pad with a list of questions. I think that's actually quite a good thing to do. So, don't be sort of shy about that. It's often helpful to bring someone with you to listen with you about the things that I say, because they'll have a different angle on it. You don't have to. There you go, breast augmentation, uplift, potential loss 6 stone. So that it's a difficult one that as well, Jess. That one in terms of uplifts, augmentations, and how it's going to look, and what do I have a lift? Do I have implants? If I do have implants, what size, what type of implants? There's an awful lot to go through. So if it is a bit too daunting, I always say, look, listen, the first one, we're just going to get the information out there. I'll write it all down in a letter, and I'll write to you after the consultation. And I always say to people, you're welcome to come back. So don't worry about coming back. You just come back and we'll go over it all again. So don't feel you have to be 100%, have all your questions and everything lined up. Oh God, I forgot to ask them that. You'll have my email address. You can always email me questions afterwards. And if I can answer it by email, I will. Or you can phone. We can set up phone calls, video calls, or you can just come back to clinic. You're always welcome to come back to clinic as often as you want. So don't worry, Jess, is the main thing. Don't worry, and we'll see how we get on, and it'll be lovely to see you in the new year. But if you want to bring a list of questions and bring someone with you, then that's fine too. Why is it important to know all of your medical history, even for a minor operation under local anesthesia? Right. Well, anyone in the house tell me the definition of a minor operation? Anyone? Right. Well, the definition of a minor operation, I'll jump in, is one that's not happening to you. I.e., no such thing as a minor operation. They're all major operations. So, we say, minor op and things like that, but it's not really a minor op, is it? Even if you're having a mole or a cyst, it's a big deal for you. So all operations are major operations. And it's as a doctor treating a patient, we always, the very basics of medical school, we are set certain things to ask people. We ask them the presenting complaint, what's the problem, the history of the presenting complaint, so how did it come about, and if someone's got the stretched earlobe, that might be pretty obvious. Well, presenting complaint, my earlobe stretched, history of the presenting complaint, I put this thing bigger and bigger and it's stretched out, so that might not be a great deal for some things. But then we ask for your past medical history, then we ask for your drug history, allergies, smoking, and social history. So those are set things that we ask for everybody, no matter what you're having done. And it doesn't matter whether you're having a minor op or a major op. We have to know these things. So why? Well, certain drugs might affect to clot for bleeding. So you might make you more prone to bleeding. That might be something we're going to think about. We want to know if you're allergic to anything, if you're allergic to some of the dressings that we use, or some of the ointments and the topical treatments we put onto the scars to make them heal up well. You might need to know a bit about your social history. Are you working? What do you do? Are you going to go back to work tomorrow and start lifting heavy things, or maybe we better not do the op today? So there's lots of reasons why we need to know your medical history, even for a local anesthetic minor, inverted commas, procedure. It's good practice. And, if there is anything, like if you're on steroids or what have you, then we might worry a little bit more about infection. And, oh God, sorry, nearly removed Marim from the feed there. Sorry about that. Pressed the wrong button to say hello to Corinne. So yeah, there's several reasons, and above were just a few, but it's good practice. So don't get annoyed if we ask you about your medical history. If you haven't got a significant medical history, and it does take 2 seconds, and if you have, then it's probably more important. So it's a win-win. If you have a skin flare-up of either eczema or psoriasis, would surgery involving the skin still go ahead? No. the thing about this surgery is it's always elective surgery. This is planned surgery. And the thing about elective surgery is you really have to be in optimum condition before having your surgery. So if there's anything at all that would affect that, so if you're feeling a bit ill, if especially if you've got a flare up of your eczema or psoriasis over a bit that's going to be cut through, eczema and psoriasis reduces the barrier of the skin and increases the risk of bugs and infection getting in there. So we certainly wouldn't want to cut through an area of active eczema or psoriasis doing an operation, because your risk of infection will be increased. So yeah, the thing about all of this surgery, you will find that we'll have a low threshold to move your appointment, postpone your appointment, because you really want to get the best result possible. And if by leaving it for 6 days, or I don't know why I said 6 days, a few weeks or whatever it is, maybe 6 weeks is more realistic. But anyway, if by moving it by a certain period of time, you're going to get less risk of infection or less risk of problems, then we would do that. So if you've got a flare up of your psoriasis, if you've got a flare up of your diabetes or your blood pressure or something like that, if that's not well controlled, then we would also think about rescheduling and postponing it. And we've got no problem about rescheduling and postponing operations. We want to do it at the best time for you. Sorry I'm late to the party. JJ was getting carried away, packing my bag for next week. This time next week, Corinne, it'll all be over. Will it not? Yes, it will. Yeah, I'm going to get packed as well, Corinne. I'm going to get packed too. Looking forward to it very muchly. And yeah, so is it possible for deep non-absorbable sutures to come to the surface of your skin? Yes. So basically, there's different layers. I've got a lot of stick on YouTube over a video that I did. It wasn't a video that I did. It was just one of these Q&As. We chopped it up as a snippet and put it on YouTube. And it was called something like "How Long Does Dissolvable Sutures Last?" was the title. And basically, I said, look, because that was the question someone asked. So that's what they put as the title of the video. And my answer was, it depends. It depends on what sort of dissolvable suture you've got. Because there's some dissolvable sutures that dissolve in days, like in a week or so, and there's some dissolve that take several months to dissolve, and there's ones in between that take several weeks to dissolve. So you can't really say how long a dissolvable suture lasts. Also, the knot takes longer to dissolve than the suture, because it dissolves by being in contact with water, and the knot is not as in contact with water at the center of the knot. So I've got all these comments saying, you never said how long it takes to dissolve. I'm like, well, that's because certain operations, things like tummy tucks, particular, I guess that's the one that springs to mind. We have different layers of sutures. So in plastic surgery, we often put little layers of sutures in, especially when you've got a deep wound, so that when you put your skin layer in, there's no tension on the wound, and the wound's completely together before your skin layer goes in. So in tummy tucks in particular, there's at least 3 layers. There's actually another even deeper layer, but let's call it 3 for the sake of argument. And we use different sutures for those 3 layers. So for the very deepest layer, there's PDS, and then for the higher up layer, there's Vicryl, and then for the skin layer, there's monocryl. They're all dissolvable sutures. So PDS, Vicryl, and monocryl are all dissolvable sutures, but they're different, and PDS takes a long time to dissolve. It's a heavier suture, and it takes a long time to dissolve. And we can do that because we're putting it very deep. We're putting it well away from the skin. As you get closer to the skin, you'll put dissolvable sutures that dissolve more quickly, so dissolve more like weeks rather than months. So that's your Vicryl and your monocryl. They dissolve more quickly than your PDS. And then around the belly button, personally, I use something called a Vicryl Rapide actually in the skin. So that dissolves, that's sort of days that dissolves, really. So there's different. So what was the question? So the question is it put so deep? So sometimes, yes, if they get tired of, if the body gets tired of the stitch being there and thinks it's not dissolved yet, I'm going to spit it out. It spits it out. And so that you can get problems with wounds coming out of the wounds, often with breast reduction and sometimes with tummy tucks. And they're dissolvable sutures which are underneath the skin, usually not the PDS actually, usually not the really deep one, usually the ones which are a bit closer to the skin. And sometimes you get a localized infection around it, and it gets this yellow stuff, and it doesn't look very nice. But it's just the dissolvable suture the body saying I've had enough, and then it spits it out. So that is not uncommon, particularly with operations like breast reductions and tummy tuck. And people think it's got infected. It's not really got infected. It's just a bit inflamed. And once the stitch comes out, the body's happy, and it just heals up. So it's a nuisance more than anything, and it can happen when dissolvable sutures are used. You see little red marks. Corin's saying, I can't wait, JG, literally counting the hours. Jess, what you got? Not a question. Tell us a random fact about you. Jess, what? Oh, we've got trouble here. Oh, we've got trouble with Jess, guys. We got, what do you mean a random? No, Jess, this is, I don't know what the, I don't know how this was sold, Jess, but this is a serious Q&A. Yeah, it's with a serious medical professional. I think you can see there's a serious medical professional in front of you here. So, yes, fantastic question. God's sake. Yeah, all right. So there's a serious medical profession here. All right, Jess, you got it. Listen, I used to be a member of the Forestry Commission at Cannock Chase. Yeah. Now it did expire June 2022. But who knew that? I was a Forestry England member of Cannock Chase until June 2022. Okay. So a random fact about me: did it for the parking. I haven't been there recently. And do you know what else I did? I changed cars, and then I had the number plate of the old car. So I still had to pay for parking, even though I paid for a year's parking. So that's why I cancelled it. But then I realised you can have actually 2 cars on it. So I should have put I didn't realise you could have put a new car park on it. You see, bet you hadn't wished you'd asked that question. Yeah, I'm a troublemaker, Jess. Yes, Jess. Let's keep it on track, okay? Any Forestry England / plastic surgery questions, gratefully received. So listen, in case you haven't noticed, I think you'll realise the reason there's not many people around, it's not because of me. It's not because of my reach. You know, there's only one person on Facebook. That's okay. It's because of the football. Yeah. If it wasn't for the football, this place would be buzzing. Ask Corin. There's usually a similar sort of number of people actually. But you know, anyway, right. Listen, I'll say I'm done. I'm done with my questions. Done. Add enough. I should have put them on the screen for Facebook, but hardly anyone to. Well, I shouldn't say hardly anyone because you two look at that. I feel bad now. Elaine Louise has said something. Elaine Louise is here, so I wouldn't say hardly anyone. There is Elaine and someone else here. So there you go. There are people here. But listen, I am going to go next door and for who are we supporting? Come on, who are we supporting? I'm going to go. I mean, we're going underdogs. We're going Croatia. Or we're going Argentina. I mean, I think Argentina probably, you know, got the advantage, haven't they? But anyway, I don't know. I don't really mind that much, to be honest with you. Right. Anyway, Corin, I'm going to see you next week. Jess, so I'll see you next month. I think the email went a little late. No reminder on Facebook either. All right, Corin. All right. God, we've got a social media manager in the house. I'm doing my best here, Corin. I was watching the telly while I was doing the email, and then I thought, oh my God, it's 6:54. I've got to do my thing in 6 minutes. I better send the email out. And it probably took a bit of time to get through. Yeah. All right, Corin. There you go. Jackie's here. No reminder. I think Facebook's playing up, you know, because I did put one in, but then I probably put it in about 6:10. Do you know what, Corin? I need to be putting these reminders in at 3 o'clock in the afternoon, don't I? 2023, I'm going to get a system where I'm going to do things properly. Yeah. New Year's resolution. Do things properly. 2023. I'm going to see you bright and early. Look at that. Mileto Aesthetics has just joined. I'm going to see you bright and early, Corin. And yeah, I'm going to go and watch the football now. And next year, I'm going to put proper reminders out and stuff. But until then, I'm going to go and put my feet up on the sofa. And I'll suggest you do likewise. Elaine, thanks for coming.